Imagine you were in a room with 100 people. There would be a good chance that at least one of the people in that room has used anabolic steroids. That's according to a 2014 study published in the American Journal on Addiction. I'm Niko Portillo, and with such a high prevalence of anabolic steroid usage in our society, it's important that we spread information on these substances so that informed decisions can be made regarding their usage. As a biology major, fitness enthusiast, and bodybuilding fan, anabolic steroids has always been a topic of interest of mine. And today, I'm going to inform you on what anabolic steroids are, how they work, and the health risks associated with their usage. I'd like to begin by showing you the structure of testosterone. All anabolic steroids are derivatives of testosterone. By altering the structure of testosterone, a number of synthetic compounds can be made which mimic the effects of testosterone. And a lot of these compounds are of higher potency than testosterone, meaning they exhibit the effects of testosterone in an exaggerated form. There's a large body of evidence which has shown that the administration of anabolic steroids leads to an increase in muscle size and in muscle strength. It is these desired outcomes that drive people to take anabolic steroids. Depending on the structure of the compound, anabolic steroids can be administered either orally or by injection. So how do anabolic steroids work once inside the body? The anabolic steroid is going to freely diffuse through the cell membrane, and then it is going to bind to a hormone receptor, an androgen receptor. This is a protein within the cell. And once it is bound to this protein, the steroid protein complex is going to enter the nucleus. In the nucleus, it is going to act as a transcription factor, promoting the synthesis of new protein. So ultimately, the effect of an anabolic steroid is an increase in protein synthesis. And this explains why anabolic steroid administration results in increased muscle size and strength, because there are more proteins being created to build and repair muscle fibers. The benefits of anabolic steroids might be appealing to some people, but these benefits do not come without risks. In 2018, the National Institute on Drug Abuse published a research review which gives a comprehensive overview of the health risks associated with anabolic steroid usage. I'd like to go over the findings of the review. It was shown that anabolic steroid usage results in negative effects on several different aspects of normal body function. The first aspect being cardiovascular function. Anabolic steroid usage can result in high blood pressure, artery damage, and an increased risk of heart attacks, strokes, and blood clots. The second aspect affected is the hormonal system. By disrupting the natural balance of hormones in the body, anabolic steroids can result in shrinkage of the testicles, decreased sperm production, male pattern baldness, and hypogonadism in males. In women, it can result in deepening of the voice, decreased breast size, and excessive body hair. The third aspect affected is the musculoskeletal system. When taken in adolescence, anabolic steroids have been shown to stunt growth. And for all anabolic steroid users, usage is linked to a greater risk of tendon injury during exercise. These injuries during exercise can be extremely traumatic, as demonstrated by the photo shown. The man in this photo experienced a pectoralis tendon tear. The fourth aspect affected is the liver. Anabolic steroids, especially those administered orally, can cause a significant amount of damage to the liver. And it can also cause tumors within the liver. As a result, anabolic steroid users often present with jaundice, which is a sign of liver failure. The fifth aspect affected is the skin. Oftentimes, anabolic steroid users' skin is excessively oily. and there can be severe acne present. There can also be cysts and abscesses surrounding the injection sites. The picture shown here displays acne and acne scars as a result of anabolic steroid usage. Perhaps the most alarming effect of anabolic steroid usage is the psychiatric effects. This includes increased aggression, mania, delusions, and anxiety. And these effects are especially prevalent in individuals with pre-existing psychiatric conditions, such as anxiety, or as we discussed in class, glossophobia. You can imagine how anabolic steroid usage would exacerbate these issues in these individuals. It's interesting that this class of compounds, these testosterone derivatives, that seem simple in their mechanism of promoting protein synthesis, can cause such a vast array of negative effects throughout so many different body systems. And I want to reiterate that it is important that the negative effects of anabolic steroids are known so that people can make smart decisions. So I'll leave you with this. At UCCS, there are currently around 12,000 students enrolled. By the prevalence statistic that I talked about earlier, it would be estimated that at least 120 students currently enrolled at UCCS have used anabolic steroids. Now that's a significant number, and we need to ask ourselves if the people around us and the people in our community are truly aware of the substances that they're putting in their body and the effects that those substances can have. Thank you.